the artificial intelligence surgery. So thank you, Andrew, for this invitation. And because I am a clinician, and I am a surgeon, this is a real challenge for me. But for what we have seen today, I think that artificial intelligence and surgery, like every other daily real life activities, need to face each other and to implement each other. So we start from here, and I talked to you about natural processing language. What is it, and what it can be its role in the operating room. A basic definition of what is natural language processing could be like the evolution of the interaction between artificial intelligence and linguistic and human language. NLP, it's a branch of artificial intelligence that focus in understanding the human language, but not only simple words, but even by extracting concepts and meanings. It's able to convert a qualitative and unassessed clinical text into usable data. And together with the computer vision, it represents the most common subfields of artificial intelligence employed in medicine and surgery, because it's able to convert into a computer-based algorithm that handles and elaborates the natural, that it's the human language, and make it suitable for computation. Here you can see probably the most well-known system of home assistance based on natural language processing that we all know very well. But if we think about medical applications, probably the electronic health reports is the widest application of NLP. Medical health report contains a huge amount of clinical data of our patient or of a specific population. And these clinical data are collected with human language, which is by definition complex, unstructured, and telegraphic. And the decoding of this kind of language is for sure time consuming. It could lead to mistakes of interpretation, because the interpretation is absolutely personal if made by a human being. We need a huge amount of human resources to decode data from electronic health report. And this means that it's an expensive procedure. The limits of decoding a human language is that we don't have a controlled vocabulary that is uniformly accepted globally. We can have different words to define the same concepts, or at the same time, we can have the same word with overlapping or meanings. And we have so many different natural language processing models based on that specific electronic health reports data that are different from institution and across countries. So we don't have a unique model applying NLP for all the data available globally. And last but not least, there are only few studies focusing on surgical oncology, thinking about NLP and surgery, in contrast with the fact that the major interest of artificial intelligence is mainly oncology. We've said natural language processing decode a huge amount of info, but because we're surgeons, so as we have seen with my colleagues before, we are very practical. We like to get to the point. So in this case, how could we use the fact that a machine is able to decode our language into an algorithm? How can we use these to be beneficial for us in the operating theater and for our patients? We can analyze different aspects. NLP can help us to prevent intraoperative accident. We already have seen some examples, or to predict postoperative events, or probably this is not enough. if these two concepts and these two abilities cannot be translated in an educational and training system for the next generations of surgeons. We start with the possibility to prevent intraoperative accident. For example, and I always try to think in a practical way, if we have the possibility to decode surgical patients' clinical data from medical notes, from electronic health reports, and to associate this clinical data to the verbal comments, the discussion, the language in operating theater connected to the operative images of different surgical steps of a single surgical procedure, and connecting them to the intraoperative parameters registered from the anesthesiologist and the language between the anesthesiologist during operation, and connecting them with the strategies and the decision making by that surgeons for that operation to that single patient. We can decode an algorithm that could be able to identify some high-risk situation to develop an intraoperative accident. This is just an example to help us to identify an example of what could be some specific terms that could highlight the attention for possible intraoperative events during a surgery for spine surgery, words like repair, iliac vein, prolane, which is the suture that surgeons use to repair vessels. These could be all terms that can be decoded to identify high-risk situations. And the important thing from this paper was that the NLP algorithm had a specificity of 0.93 and a negative predictive value of 0.99, which means the fact that if some terms, specific terms, if the decoding of the verbal language did not identify high-risk situation, this wouldn't happen. The possibility to link each individual surgeon's intraoperative strategy and conducts and the postoperative data of that population of patients and connect these with the other experience from several other surgeons would probably allow the machine to make predictions and even recommendations based on a collective knowledge, and it could exponentially enhance cognitive capabilities by providing experience that would have taken probably many years to decades to achieve to a single surgeon. So this is one of the most promising and exciting aspects of natural processing language and computer vision. NLP has been already validated as a predictive model to predict postoperative complication, and the most studied one are the surgical site infection, anastomotic leak, and the onset of deep vein thrombosis and pulmonary embolism. NLP models, when compared to non-LP models of decoding human language, could be similar to predict postoperative events, but as we said, it is superior in ruling out eventual postoperative events. And decoding, when talking about transferring this system to an education system and training of surgical residents, the possibility of decoding the intraoperative dialogue between residents and faculty and combining NLP and computer vision can create and implement a data set of technique and surgical strategies, like having a huge textbook of surgery, combining experience from many surgeons, many surgical procedures, and many interactions between residents and surgeons. And this model could guide surgeons in real time, as the author said, as if they had the world expert in surgery looking over their shoulders, which is the real meaning of mentoring and tutoring a surgical resident. And this is an example, always using laparoscopic cholecystectomy, as we said before, by Pietro Mascagni, with the aim of this study to have a surgical workflow analysis that was speech-based, so based on the human language, as a means to characterize, identify the process, the cognitive process behind the surgical decision-making during operation. The authors monitored the audio cues during the surgery, and they defined the patterns of conversation related to that specific surgical phase. This is just to show you the example of how you can divide a single operation in different surgical steps. But we still have open issues because we don't have a worldwide common vocabulary, as we already said. The sequence of the surgical steps can change for clinical reason, and the onset of unexpected event during surgery can make us change the surgical step sequence. And patients could have anatomic variant that made us change the plan. And the main reason, because it's probably the major difficulty in homogenizing all these different steps of surgery and interpretation of steps, is that we are 7 billion of people in the world, different races, different biology, different genders, and different individual difference among 7 billion people. And if I need to think about what could be the ideal setting, probably the integration of the all artificial intelligence branches could lead to mix knowledge and experience to get the real knowledge about the possible application of artificial intelligence in surgery. And why we are all distracted to think how could be the best technical performance of artificial intelligence in surgery, we never need to forget that we have still some ethics and legal issues to face, because to build valid models and we need huge amount of clinical data which are necessary to sustain the use of artificial intelligence surgery. But this huge amount of clinical data need to be protected and preserved with the privacy rules, because they are propriety of our patients. So thank you for your attention.